Good morning. This is Dr. McDaniel. I'm a board-certified obstetrician gynecologist in New York City, and I'm bringing to you all things health-related for women. Thank you for joining me at the corner today. And I'm inside the car. It's Saturday. We're at the horse farm. The girls are taking their horse riding lessons, and I'm inside the car because of what I just showed you, which is nasty weather. It's very, very, very windy, very blustery outside. Lots of rain, lots of cold, so very unpleasant. So I can't walk around today. I'm in the car. I was in they have a little ante room for the large riding area that's covered inside, but my allergies are kicking up, so I couldn't even sit there. I started coughing and sneezing. I could feel a little asthma. So unfortunately, I'm stuck in the car this morning. But today I'm answering a viewer question. I had a viewer ask me if I could speak on hysterectomy. She didn't actually say why or what details, but I assume either she or someone she knows or a loved one is having hysterectomy and she wants to get some information on it. So I'll be speaking on hysterectomy today. Now, this is going to be a several-part series because there are different types of hysterectomies, different modalities, different indications for hysterectomy. So I'll be speaking on each of those in a different section. So today I'm going to speak on indications for hysterectomy, and I'm trying to keep the presentations concise and relatively short and sweet. So if I feel like it's going too long, I'm going to stop it, and then we'll continue at another session so that these don't become mega long presentations. So as I tell patients, sometimes they come in, they're like, can't I just take this uterus out? I'm tired of it. And I have to tell them, this is not the wild, wild west. We can't just take you to the hospital and perform a hysterectomy for absolutely no reason except patients tired of having a uterus. That's not an indication, and we will not be allowed to go into the operating room. There is a tissue board. The tissue board is a panel of physicians that have to review the cases that are coming into the operating room to make sure that the indications or the reasons why we're performing the surgery is standard of care. So you can't just willy-nilly take someone for surgery that was completely inappropriate. So I guess the biggest reason, the only reason someone can say they're tired of having uterus and have it removed is if they're undergoing a sex change, right? So if you no longer want to be a woman, you want to be a man, you're going through all of the different steps to have a sex change, then yes, you will get your uterus removed simply because you don't want it there. But if you're not having a sex change, you can't just have the uterus removed for no reason. So the next biggest reason of what will indicate you need a hysterectomy. And a hysterectomy is, for those of you who aren't aware, is the Greek. Hyster means uterus. Ectomy always means to remove or to take out. So it's removing the uterus. Now, the biggest reason for removing the uterus is going to be cancer. So if someone has uterine cancer, and there are different types of uterine cancer, if you have uterine cancer, we remove the uterus. The only reason not to remove the uterus would be if the physician has evaluated the imaging studies and the cancer is so horribly spread, it's penetrated everywhere in the pelvis, that removing the uterus is going to create almost a danger because of the abnormally increased blood flow and potential blood loss that can occur, and because it will not improve your medical status. Then the recommendation would be radiation or chemo first, or potentially only to cause the cancer to shrink or to reduce it in size and make it more amenable to surgery. So, but uterine cancer definitely is predominantly an indication for hysterectomy. Ovarian cancer is not always an indication for hysterectomy. If someone has ovarian cancer and it has not spread throughout the pelvic tissues, the uterus, then you don't need to have the uterus removed if it's just the ovaries. Oftentimes, because ovarian cancer is stage 4, when it's discovered, it will require, or the recommendation will be made to remove the uterus. Cervical cancer is always an indication for hysterectomy unless the cervical cancer has spread so much it's penetrated through all of the deep pelvic tissues and the what we call the parametrial tissue, so the tissues going out to the skeletal sidewalls. Then that lady would not have an indication. She wouldn't be a candidate for hysterectomy. But in lieu of that, yes, she would be a candidate for hysterectomy. In fact, cervical cancer, when it's caught early enough, is an indication for what we call a radical hysterectomy. So we take extra tissue in addition to what we would normally take for just a standard hysterectomy. So cancer is the most predominant indication for a hysterectomy. Now, in lieu of cancer, it would be fibroids. Fibroids are not always an indication for hysterectomy, but if they're growing rapidly, then the concern is that maybe that lady's in the 1% of fibroids that will turn into a cancer. So leiomyosarcoma or rhabdosarcoma, it's usually going to be leiomyosarcoma. That's a cancer of the fibroids, cancer of the uterine muscle. That would definitely be an indication for hysterectomy. But fibroids just in and of themselves, you don't need a hysterectomy for fibroid uterus. Predominantly, we treat fibroids with medication. If someone has a really huge fibroid uterus and they're looking pregnant, then sure, they are a candidate for hysterectomy. So the average uterus is pear-sized uterus. It's about the size of a regular pear, Anjou pear. And fibroids are balls of uterine muscle, and they respond to your natural hormones. So fibroids are an abnormal response to a normal hormonal environment. Approximately 15 to 20% of women will have fibroids. Most of those women will not have fibroids that get large enough or become cumbersome enough or symptomatic enough to require hysterectomy. But if they do, it's usually because they're looking and or feeling pregnant. So fibroids can go from just really, really tiny fibroids, so your uterus is still normal size, 6 to 8 centimeters, and they can become humongous. Now, obviously, over the 30 years that I've been practicing, I've seen fibroids of varying sizes, and I've seen fibroids where someone looks like she's full-term pregnancy, not just with the single, but with a twin pregnancy, 42, 44 centimeter size fibroid uterus, and we're begging her to have the hysterectomy done because it's just uncalled for. And sometimes she will, sometimes they won't. So yes, if you have a symptomatic enlarged fibroid uterus, we don't have medications to shrink fibroids except for temporizing medications like gonadotropin, so leuprolide, things like that to shrink it. Puts you through a temporary menopause to make surgery easier. But outside of that, the treatment for symptomatic enlarged fibroid uterus is predominantly a hysterectomy when it's that huge. After symptomatic enlarged fibroid uterus, another indication would be just that your pelvic muscles, which support the pelvic organs being your bladder, your uterus, your rectum, it's too weak. It's just been stressed out through a variety of physical phenomena, and it's weakened. And when the pelvic floor, the pelvic muscles are weak, the organs that it supports start to fall down due to gravity, and they fall through one or all of the pelvic orifices. And the pelvic orifices are the urethra, the vagina, and the rectum. So, sorry, I'm at the horse farm, so I have allergies. Even though I'm not in the riding stadium, I'm not in the anteroom. I was in the anteroom earlier, and then I started sneezing and coughing, regardless of the fact that I took an allergy pill this morning. So that's why I'm in the car. I was going to do the presentation in the anteroom, but it was just too tough. So let's see. So those three orifices are the urethra, the vagina, and the rectum. As the pelvic floor, the pelvic muscle gets weaker, the organs start to fall through it. And the largest of those three organs is the vagina. So the vaginal orifice, the uterus will start to fall through the vagina, just like you're delivering a baby, but you're not delivering the baby, you're delivering your uterus. We call that uterine prolapse. There is an option for medical treatment with a pessary, which is just a little device that we stuff into the vagina to hold the uterus up. That does not always work, and it's not always feasible for a woman to constantly stuff that in the vagina every day. So a hysterectomy is a treatment of choice. I'm going to stop things there because I can see I've already gone to 10 minutes. So I'm going to continue the indications for hysterectomy on the next presentation. Thank you for joining me at the corner today. Please hit the like, subscribe, thumbs up, follow buttons if you enjoy the content. Please make sure you check out not just the Facebook and the YouTube channels. They're all GYN Corner, but I'm also on the podcast, all of the different platforms for the podcast. I'm on Spotify, Google, the usual haunts. Have a great rest of your day. Bye.